What if I told you that one small habit you do every single night, something you probably think is harmless, could be silently increasing your risk of heart problems, blood sugar imbalance, memory decline, and chronic fatigue? What if I told you that stopping this one habit could improve certain health markers by up to 30–40% in some people over 60? I know that sounds too simple. You're probably thinking, Doctor, if it were that easy, someone would have told me already. And believe me, I understand that skepticism because the people I see every day felt exactly the same way. They tried supplements, they tried strict diets, they tried walking after dinner, cutting sugar, cutting salt, tracking steps, tracking numbers. Still they feel exhausted. Still they worry. Still they wake up feeling like they never truly rested. My name is Dr. Evelyn Carter, and for over 20 years I've worked with adults in their 60s, 70s, and beyond. People who are genuinely trying to do everything right. And yet they keep hearing the same thing. Your numbers are creeping up. Blood sugar, blood pressure, inflammation markers, morning fatigue. These are not careless people. These are vigilant people. People who've spent thousands of dollars trying to protect their health. People who go to bed worried and wake up already tired. And tonight I want to talk to you about the most harmful sleeping habit doctors see again and again. A habit so common that most people don't even realize it's hurting them. Before we go any further, let me ask you to do one simple thing. Please comment below and tell me where you're watching from, your country or city. I read those comments personally, and it helps me understand who I'm speaking to. And let me be absolutely clear right now, this is not about replacing medications. This is about supporting what your doctor is already doing and helping your body respond better. Now let's talk about what's really happening inside your body as you age. After the age of 60, several critical physiological changes begin to accelerate, quietly. First, your thirst mechanism weakens. You don't feel thirsty even when your body is already mildly dehydrated. Second, your kidneys become less efficient at conserving fluids overnight. That means you lose more water while you sleep than you did in your 40s. Third, your blood vessels stiffen slightly, making circulation more sensitive to fluid balance. And fourth, and this is the overlooked factor most people, including many healthcare providers, completely miss, your overnight fasting window becomes dramatically longer. Think about it. If you stop drinking fluids at 7 or 8 p.m. and don't drink again until 7 or 8 the next morning, that's 10–12 hours without water. Even mild dehydration at that level has been shown to measurably increase morning blood sugar, raise cortisol, thicken blood slightly, and reduce oxygen delivery to tissues. Not severely, not dramatically, but consistently. And consistency is what shapes long-term health. Let me tell you about Gerald, age 68. Gerald came into my office frustrated, truly frustrated. He looked at me and said, "Dr. Carter, I don't understand what I'm doing wrong." He was on his medication. He walked 30 minutes a day. He avoided sugar. He tracked his numbers every morning. And still, his morning readings were higher than they should be. His wife sat next to him and said quietly, "He goes to bed worried every night." So I asked Gerald one simple question. "What time do you stop drinking fluids at night?" He answered immediately, "Around 7 p.m. I don't want to wake up to use the bathroom." That was the moment. I asked, "And what time do you drink your first water in the morning?" "After breakfast, around 8:30. That's nearly 14 hours without water." Gerald blinked and said, "That matters?" That was his aha moment. We didn't change his medication. We didn't change his diet. We didn't change his exercise. We made one strategic adjustment. Here's what we did. He drank 250 ml of room temperature water within 5 minutes of waking. Not cold, not iced. Room temperature. Then, 15 minutes before breakfast, he drank another 150 ml. That's it. 2 weeks later, he called me, and I could hear it in his voice. Less tension, more energy. 1 month later, his morning numbers had improved by 18 points on average. He laughed and said, "I honestly thought you were a little crazy, doctor, but this actually worked." Now, before I teach you the exact method, let me explain the 3 most common mistakes people make. Mistake number 1. Stopping fluids too early. People treat nighttime like a desert, but your body is still losing water through breathing and skin all night long. Mistake number 2. Drinking everything at once in the morning. That's like dumping a bucket of water on a dry plant. The soil can't absorb it properly. Mistake number 3. Using cold water first thing in the morning. Cold water can temporarily slow digestion and blood flow when your system is already sluggish. Now, let me introduce the method I teach my patients. I call it the CALM method. C stands for calibrate. Within 5 minutes of waking, drink 250-300 ml of room temperature water, 22-24 degrees C. This gently rehydrates blood volume and lowers morning stress hormones. A stands for activate. Wait 10 to 15 minutes, then drink 150 milliliters before breakfast. This primes digestion and improves glucose handling. L stands for limit. Reduce large fluid intake only in the final 90 minutes before bed, not 3 to 4 hours before. M stands for maintain. Keep small sips available if you wake at night, just enough to prevent dehydration, not enough to disrupt sleep. Physiologically, this works because it restores overnight fluid balance, improves blood flow, reduces morning cortisol spikes, and supports kidney function. Now let me tell you about Margaret, age 72. Her A1C had been creeping up for years. She started with just one single change, the morning calibration step. 3 weeks later, she said, "I feel genuinely different, lighter, clearer." 3 months later, her A1C dropped by 0.6 points, and her doctor reduced one medication. Now, practically speaking, how do you do this? Use a 350 ml reusable bottle by your bed. Fill it every night. That's your visual reminder. Week 1, you may notice more bathroom trips. That's normal. Week 2, morning energy improves. Week 3, 4, numbers begin to shift. Beyond that, long-term stabilization. I hear this phrase constantly, "Doctor, I just feel genuinely better." Now let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop medications. Continue following your doctor's plan. If you have kidney disease, heart failure, or take blood pressure medications, talk to your physician before making changes. Finally, let me tell you about Robert, age 74. He told me with tears in his eyes, "I feel like I completely failed my body." He had struggled for 18 years, tried everything, feared what was coming next. His habit, no water after 6 p.m., ever. We applied the CALM method. 3 months later, he hugged me and said, "You gave me my life back." He wished he'd known sooner. So here's my challenge to you. Try this for 21 days. Follow the exact steps. Pay attention. Comment your results below. If you made it to the end, type, "I choose better sleep." Share this with someone you love. Subscribe. Turn on notifications. Remember, small strategic changes implemented consistently create genuinely measurable results over time. This is Dr. Evelyn Carter, and I'll see you in the next video.